Hello, Create AState. My name is Jarrod Rogers, and I'm an IDS pre-physical therapy student, and I'm here along with my mentor, Dr. Pribyslavaska, to represent the Health, Physical Education, and Sports Sciences Department with our research on an analysis of generalized concussion scales and their effectiveness in the pediatric to adolescent population. Some quick background here. A concussion is a mild traumatic brain injury usually caused by a jarring movement or blow to the head. ER visits for concussions have increased by 200% in the 14 to 19-year-old population in the past decade, as well as sports-related concussions, accounting for 3.8 million MTBIs reported within the past year, making this a prevalent topic among the medical and sports communities. The SCAT-3 and Child SCAT-3 scales are symptomatic diagnostic scales, which limit adolescent concussion severity identification. These are acute diagnostic scales and also have no tiering. This scale has been known to have accuracy in diagnostic measures, but lacks measurement of severity and also lacks a weighted system. Our research involved an analysis of various standard concussion scales, two of which are shown here. The A scale is the CDC standard scale for concussions with no scoring weight, and this determines concussions in patients greater than 11 years old. This is a standard diagnostic scale which groups all ages over 11 together, with no weighted scoring for different developmental phases. The lack of a weighted scale is concerning, as the neurodevelopment of children and adolescents is not taken into account. The cerebrocerebellum and the spinocerebellum are brain centers responsible for motor movement and its correction, and their volumes don't plateau until much later into adolescence. These graphs represent a longitudinal MRI study of the cerebellum performed on a large sample, and you can see the plateaus of the cerebellum as indicated by the arrows, occurring in later adolescence. Dual task costs are deficits occurred in gait when performing a secondary task simultaneously. Arkansas Children's Hospital performed a recent study with healthy adolescent patients in a dual task scenario, performing a walking route while simultaneously completing a visual spatial task. This study showed an increase in dual task costs and double limb support, meaning more time walking was spent on both legs compared to a single leg each stride, representing a deficient gait. A study done by the NCAA showed a subsequent musculoskeletal injury is 3.3 times more likely to occur in a patient within 90 days of post-concussion occurrence compared to a non-concussed control group. These graphs clearly show the effects of dual task costs. If you examine the NCAA graph, you can see the large gap between the control and concussed groups, which all were young adults. Accounting NCAA athletics as a very complex dual task activity, these studies clearly show the deficiencies in the adolescent population via dual task costs compared to the adult population, which has complete neurodevelopment. Two post-concussion evaluation scales are shown here. Post-concussion symptom inventory is a subacute symptomatic scale which is tiered, but is all subjective questions based on a sample of highly injured athletes showing bias in their sample, and also there's a bias of symptom reports, which would mean that an athlete might have a return to play bias. Post-concussion symptom scale is also a subacute symptomatic scale for patients above 11 years old, which means that they're all grouped together. It is also completely subjective and overshoots patient abnormalities. From this, I conclude some revisions needed for these concussion scales. A subacute scale setting, objective and subjective test measures to help eliminate return to play bias, multiple tiers of weighted scoring to account for incomplete neurodevelopment due to age to differentiate pediatric, adolescent, and adult populations, normative data for varying concussion severities to account for non-athletic and athletic concussions, and baseline test implementation to compare an athletic patient's pre- and post-concussion performance measures. Some possible future research to take place would be the use of child SCAT3 and SCAT3 for patient diagnosis of a concussion. revisions of the PCSI and PCSS scales, which I mentioned, a longitudinal study occurring with data scoring and evaluation of recovery times for each patient, and then using this data in order to create a recovery-based scale, meaning that scores would help base a time of recovery. The next two slides credit my references for the literature review. I would like to thank Dr. Pribyslavaska for all of her help, the HIPIS department, everyone here at Create AState, and to all of you for listening to my presentation. Thank you.